November, William Goodwin on Kuhn's speciation metaphor and the birth of biochemistry. Then 2 weeks from today, Friday the 26th, we have the first annual lecture series lecture coming up. That'll be at 3:30 p.m. in the afternoon. Andrea Lucker's on model templates and model-based education. So terms in full swing, lots of exciting talks coming up. We also wanted to remind you about an upcoming deadline for a call for papers for a center workshop that will be held February 28th, 2026. That workshop is to be or not to be included in a causal model. And the deadline for calls, that is October, so weeks away. More information available on the Center website. All right, so it gives me great pleasure, as Edward would say, to introduce our speaker for today, Nina Atanasova, my colleague in the Department of History, Philosophy of Science. Nina is a teaching assistant professor in the department and has been with us for a year, teaching courses in philosophy of medicine, philosophy of psychiatry, and bioethics. Nina is one of the few people that I've ever known that apparently has 2 PhDs in philosophy. One from the Bulgarian Academy of Sciences, and then more recently from the University of Cincinnati's Department of Philosophy. In addition to all the teaching she does, she also has thriving research programs in the philosophy of medicine, philosophy of psychiatry, and philosophy of neuroscience on topics such as the design and validation of animal models, big data in psychiatry, issues on death and dying, methods in neuroscience. One recent publication is titled Epistemic Issues Pertaining to Neuroscientific Methods. That's published in a Routledge volume on mind, cognition, and neuroscience. And in addition to those topics, she also works on pain, and that'll be the topic of her lunchtime talk today, titled The Surreality of Pain. So Nina, the floor is yours.
Thank you, John. Now, the way you presented me, it sounds like I'm all over the place. I tried to find some kind of commonality between everything, but being a full-time teacher for all these years is just exposed me to all kinds of topics, and that's how I usually do my research as I teach. So that's where that's coming from. And what I want to present to you today is a talk that engages in the discussion regarding eliminativism and in particular pain eliminativism. And the title of my talk comes from me wanting to find some unique angle to that conversation. Most people are quarreling over whether pain is real or unreal. So I decided that I can talk about surreal pain. Definitely will consider the experience of pain to be real, but some of the things that people would claim are real about pain, I would consider not to be quite. So certainly some sort of a subjective, dreamy state of the pain experience I would acknowledge, but I may have to disagree with others who would want to reduce pain to bodily sensations, for example. So the origins of the conversation could be traced back to 1978 with this paper that Dennett published. He did not explicitly call what he was arguing for pain eliminativism, but he did say that we should expect neuroscience or the neurosciences at the time were the sciences of the nervous system. Neuroscience was not yet a term. Once those sciences matured, he believed we will have a better theory of pain, and that's when we can build a robot that feels pain. So it wasn't pain proper that he was interested in, but it was figuring out how we can recreate the human mind, the human experience in silicon material. So that is a paper that's usually credited as the beginning of this conversation. Then the one that was more explicitly engaging with eliminativism is Valerie Hardcastle's 1997. We don't see her name here, but that's a paper that is a predecessor to her book. That is what is most familiar applications on pain. And in this book, she explicitly defended pain eliminativism. She has a big chapter there that is called Eliminating Pain. And that's what she argues for. The old ways that we've been describing pain, that scientists have been studying pain, are inadequate. So the terminology that's used to study pain has to be eliminated. Then all of it just disappeared somewhere. In 2016, people started. 2015, there's some publications that are engaging with that discussion, but not necessarily in philosophy. But this is the first philosophy publication in the 21st century that engages explicitly with this discussion of eliminativism, particularly of pain. So that was followed by another book that Coninx published in 2020. And here the main claim is that pain eliminativism has actually occurred in science, but what traditionally has been considered to be eliminativism, particularly the way the most well-known version, Churchland's version, has been articulated to things, doesn't really apply to the context of everyday life and actual folk psychology. So then since then, others have engaged with that topic. This is also 2020. Tudor Baetu published a couple of papers that are explicitly dealing with pain eliminativism, and another one that was also engaging with pain, but not necessarily with eliminativism, all around the same time. And then other publications started to come out that are explicitly engaging with Coninx's view in particular. And then eventually Hardcastle ended up arguing against eliminativism, which is very, very puzzling, considering that she was one of the first pain eliminativist, so now she is turning against some of those other authors that I consider to be arguing against pain eliminativism, but she considers herself in need of defending the notion of pain even against them. So what I plan to do in this talk is to defend the thesis that pain eliminativism has actually been successful. And I will have to, of course, qualify what I will understand by pain eliminativism. So that will be the next thing I do. But also, I will be claiming that pain is real. So I need to then describe the ways in which I will consider pain to be real, but it's still going to be that surreal thing that is not what typically is understood by the claim that pain is real. So I will go over 4 kinds of pain eliminativism. That's not going to be an exhaustive list of kinds, but it will be helpful for me to engage with the specific challenges to pain eliminativism that I will be looking at. And then I will address 2 of them, Baetu's and Coninx's separate challenges. And the way I will address that is by referring to the biopsychosocial model of pain, which is the model of pain that is commonly assumed by scientists who are involved in the International Association for the Study of Pain. So I will consider that to be the state of the art of the science of pain. And that is going to be my reference to what has happened in science. Now that doesn't mean that there are not other competing theories, but I will assume for the sake of evaluating eliminativism that this is the science that is supposed to tell us whether we should keep our old notions of pain or whether we should replace them with radically new ones. And eventually, I will present a case of the application of the biopsychosocial model of pain to an everyday context, namely in the treatment of chronic pain. And this is an approach to the treatment of chronic pain that relies on educating patients in the neuroscience of pain. And that then helps them overcome their painful experiences. And then I will conclude by summarizing what I've said. So here are the challenges, the way I am dividing them. That makes sense to me. Starting with the 2016 paper by Coninx. So I'm not going to engage with older discussions, the ones that may have been contemporary to Dennett and Hardcastle's older publications, but I'll look at the contemporary discussion. So there are two ways in which one could interpret specifically Churchland's view of material eliminativism. And those are, on the one hand, as a prediction what's going to happen once neuroscience advances. That is, we can expect that once neuroscience advances, it will replace our folk psychology. But on the other hand, it could be interpreted as a normative claim, as a prescription that once neuroscience advances, we have to switch our talk to neuroscience talk rather than to psychological, even folk psychological. So this I would be considering the predictive descriptive challenge. And this is where I identify Baetu's challenges to eliminativism. And one of the points that Coninx is making is going to be predictive descriptive. And that actually is a point at which she agrees that eliminativism has actually occurred in science. And then Coninx, on the other hand, is arguing against pain eliminativism when she points out that, and that's one of the arguments that's showing us why we should eliminate pain talk in science, because there's so many different things that we call pain that that term becomes meaningless. And that's actually Coninx's view. But Coninx is showing that there's actually a family resemblance between all of these things that we call pain. So we can still keep our notion of pain, even if there will be two things that have no commonalities. As long as there's some continuation between the similarities among all of these things, we can consider all of them to be pain, and pain is going to be real, and you do not have to eliminate that terminology. Then we have the prescriptive or the normative interpretation of eliminativism, and this is where Coninx is saying, well, even though science has advanced to an extent at which we need to eliminate our folk psychological notion of pain, that doesn't require us to do it in everyday context. We can keep talking about pain the way we've always done that, because that's a useful way for us to communicate. And then Hardcastle's new position seems to also be engaging in that discussion. She explicitly argues against Coninx's view that eliminativism has occurred in neuroscience. And her point is that we shouldn't be giving up on that talk, because we have already identified in neuroscience enough of evidence that pain is actually real. And then the most recent publication, Gligorov's, engages with both scientific and traditional eliminativism. So again, she is addressing Coninx's view, where she claims that whatever is true of everyday context has to also be true of science. So we don't have to eliminate pain terminology in science, just like we don't have to do it in everyday context. So I will engage with these two views, the ones that were mostly taking shape around 2020, and perhaps make references to the newer ones as I'm evaluating them. Now, here are the varieties of eliminativism that I want to consider for the purposes of addressing these two specific challenges. On the one hand, there's that distinction between predictive and prescriptive eliminativism, but also I want to distinguish between epistemic and ontological, and then we'll have four combinations. So we'll have, on the one hand, an epistemic predictive interpretation where the claim is going to be that elimination of theories will occur once neuroscience advances to a sufficient point. Psychology will just naturally disappear. That would be epistemic predictive. Then we also have epistemic normative, where we'll claim that once neuroscience advances to the extent to which it needs to, then we ought to, then we'll have to replace the psychological theories with this more accurate neuroscientific theory. Then we can also talk about ontological eliminativism, where we're concerned with the reference of our terms rather than our scientific theories. So here, given that science advances to a certain point, we will know that some of the entities or mechanisms or substrates or whatever ontological unit we're interested in, if that disappears from the new theory, then we just have to replace that term and move on with our lives. So that will be, I actually described the prescriptive version, we'll have to do that. But the descriptive version, the prediction is going to be that obviously is going to happen once our theories show us that some of these entities do not exist, we will naturally abandon them. So that would be the predictive kind of ontological eliminativism. So as I mentioned before, I will assume that the state of the art of science is what we see articulated by the International Association for the Study of Pain. They recently revised their description of pain recently. I think it may have been around 2020, so about 5 years, depending on our notion of recency. That would be recent. And specifically compared to Dennett's, let's say, view, that would be the recent state of the art in the science of pain. So one thing I want to point out, first of all, is that the model of disease or pathology, or in our case, pain, is the biopsychosocial model. So according to the association, all biological, psychological, and social factors are involved in the phenomenon of pain, as well as the study of pain. And then something else I want to stress here is that pain is considered to be an experience. This is why I'm also focusing on that starting point of conceptualizing pain. So we'll consider that to be experience. Something else to point out here is that this could be sensory and emotional experience, but also there's a cognitive element to our experience of pain, and that is captured by here the notion that we learn the concept of pain as we go. So these three elements correspond to the gate control theory of pain, according to which there are these three dimensions of our experience. There's going to be the sensory, the emotional, and the cognitive element of the experience of pain. And there have been multiple experiments that show dissociation between all of them. But at the neurological level, we could see that whenever there is a report of an experience of pain, there consistently is a state of the nervous system that appears, whether there is actual stimulation, that is actual sensation, or whether there is an emotional experience involved. So when somebody is claiming that there's a cognition that there is an experience of pain, that typically can also be identified as a specific state, functional state in the brain. And then the last thing I want to point out, and all of these elements are going to become important at one point or another in the talk, this here, and that is the most recent revision actually, because until the last revision here, we had associated with tissue damage. So what was added here was potential tissue damage, and we'll see why that's important, because sometimes the experience of pain occurs without any tissue damage. Even the perception could trigger that experience. All right, so with that, and then again, I'm stressing that I will consider pain to be personal experience. So that is what I will be considering pain. And then the question is, does that get eliminated? And my answer is no. So the personal experience doesn't get eliminated with their theories. But I want to show what I claim is actually going to be eliminated. So here is what Baetu's challenge is. So he looks at the biopsychosocial model. Obviously, there's a lot more going on to his view. He addresses mechanistic explanations of pain. That is what he's mostly concerned with. But again, I don't need to go into detail in those arguments. What really matters for my purpose here in this talk is that he considers the fact that the science of pain uses the biopsychosocial model of pain. There's no reduction occurring in neuroscience. So psychology remains independent from neuroscience, but also there's no elimination either. To him, reduction and elimination don't seem to be much different, but for my purposes, I want to be a little more accurate, that his view implies that neither intertheoretic reduction occurs nor replacement or elimination of psychology by neuroscience. And here my objection is that the fact that science is using the biopsychosocial model of pain doesn't necessarily mean that biology, sociology, and psychology are independent from one another, irreducible to one another. But what that's showing is that the claim that they are reducible or irreducible has to be eliminated, because we have all of these disciplines working together to explain what's going on when we experience pain. So to me, the eliminativism here refers to eliminating those old-fashioned, outdated notions that either all sciences have to stay independent or they have to be somehow reduced to a single science. To me, the contemporary state of science is of this kind of integration. That doesn't necessarily mean that sciences are getting integrated, but the methods of different sciences get integrated for the study of certain phenomena. So we don't really need to be concerned with reducing one theory or another. The way I see it working is that theories emerge based on the empirical research that uses methods from all kinds of sciences. But that doesn't mean that we need to eliminate some of those and claim that they are one or the other. So to me, that's not the this conclusion just doesn't follow from what he's observing. It just doesn't follow that we don't eliminate one theory with another. Reduction of the kind of intertheoretic reduction, I agree, doesn't happen, but I do believe that eliminativism in Churchland's, at least, articulation does occur, specifically because the biopsychosocial model is the one that's assumed. Then Coninx's view has these two elements. On one hand, there is a descriptive element, but then there's also a prescriptive element. However, curse is an ontological kind of eliminativism that she's engaging with, whereas Baetu's is epistemological. It only concerns the theories and the sciences we're interested in. So she takes Machery's distinction between scientific and traditional eliminativism, where scientific eliminativism refers to the decision to abandon a term when we recognize that it doesn't refer to a natural kind. And she points out that's exactly what's happening in the case of pain science. We do have so many things that we call pain that have very little in common, that pain doesn't seem to be designating a natural kind. So now Machery's here prescription is just eliminate that term, and she believes that that's what's happened in science. So scientific eliminativism has already occurred. However, she says this doesn't entail traditional eliminativism, where traditional eliminativism refers to eliminating terms that may or may not refer to natural kinds in the context of, in a more pragmatic context. So if people are using these terms and they successfully communicate and they successfully do things together, even if those are not accurate terms, even if they don't represent something real, we don't have to eliminate them. They're doing their thing. So she believes that traditional eliminativism simply doesn't follow from the scientific eliminativism. And her point is that there are so many things that are called pain, and we take those things from our everyday vocabulary, from our folk psychological vocabulary. And what she says, well, maybe we're just lumping together all of these things that are actually different natural kinds. It's a lumping error. But my objection is that the folk psychology may actually be performing the opposite error, namely the splitting error. So maybe pain is a more unified phenomenon than what the folk are considering it to be. In particular, the natural distinction that people make between physical and emotional pain. That is a distinction that shows up in many conversations, and even I, who have spent so much time thinking about it, would sometimes make those clarifications. However, there are some studies, some of them are outdated. I don't know what happened. People haven't been replicating them or continuing with that research program. That may be an indication that they were not all that reliable, but there were some studies, most of them were about 10 years ago, where subjects were given acetaminophen and they were exposed to scenarios of social rejection, which was considered to be operationalization of the experience of emotional pain. So you get those groups of people. Some of them have been taking acetaminophen for a while. They've taken it right before they're exposed to that intervention. And lo and behold, the ones that have been taking acetaminophen are less concerned about being isolated. So they're presumably experiencing less of emotional pain in that case. And then also there were some studies that were functional neuroimaging studies that were exposing people again to some kind of emotional pain and comparing their brain activity to the activity of people who were subjected to some sort of a physical trigger of pain. And the published results were that the brain areas that were engaged in both of these cases largely overlap. So this is taken often to be showing that the experience of pain, its neurological signatures are the same, whether we're talking about emotional or physical pain. So it may be that if we define pain as an experience, it will have its neurological signature across all of these things that people would call, and she has a long list of physical pain, labor pain, and all kinds of other pain that may or may not be metaphorical. But I want to challenge her in that line of reasoning. Maybe what the Falk is taking to be different kinds of pain is actually the same thing. So it may be that if we use this unified notion of pain, I don't necessarily want to claim anything about natural kinds, but if we're assuming that that's what we're doing here, it may be that there is some group of objects that have more in common that she is taking them to have in this case. All right, so here is how I take ontological pain eliminativism to work. So if we consider the experience of pain to be the phenomenon that we want to explain, so that's going to be our explanandum, we can come up with different explanances. Yes, exponentia. So one older theory was telling us that pain is a sensation, but then that one was eliminated. So then another one told us that pain is an emotion. But that also went away, particularly, now remember that we talked about the gate control theory where we have sensory, emotional, and cognitive aspects to the experience of pain. So this one was also abandoned. So now we still have this question, how to explain pain? What kind of thing is it? And here is where I'm claiming that eliminativism actually occurs. So all of these cases in which we rejected sensations, we rejected emotions, all of these are cases of elimination of one theory, of one explanation with another. So yeah, theories, those that have the status of theories. So we can keep doing that, but by doing this, we're not eliminating pain itself. The experience is still there and it's still in need of explanation. So we can claim that pain eliminativism occurs even if we're not claiming that pain is unreal. So we can have the notion, the term pain referred to a real thing, while eliminating theories about what it is. And here is the analogy that I want to make my case. And that is a very common example that we've probably all heard from the churchlings, the example of phlogiston. So there was this notion of phlogiston, turned out it's not real, we eliminated it. So if we think of eliminativism that way, if it turns out that pain isn't what we thought it was, we would say, well, pain is not real, we'll eliminate that notion. And most of the people who are arguing against eliminativism seem to be approaching the issue that way. However, if we think of pain as an explanandum, and the things that we'll be eliminating as exponentia, then eliminativism doesn't have to eliminate what we're trying to explain. So when phlogiston was considered to be real, it was postulated to explain combustion. But when we eliminated the notion of phlogiston, because we realized that it doesn't really exist, we didn't thereby eliminate combustion. Combustion stayed, but we came up with a different explanation. So our explanans was what was eliminated and replaced with a radically different notion. So here we didn't have an intertheoretic reduction. We certainly had a radical replacement of one theory with another, just like Churchland defines eliminativism. But if pain is analogous to combustion, that means we don't have to eliminate the notion of pain. What we're eliminating is what kind of thing we think it is. So the phenomenon is still there. And I told you I was going to talk about this neuroscience pain education, and I believe it makes the case for eliminativism. So the way it works, and I was going back and forth how I want to order these slides. So let me just go back and forth as I talk. So here is an image that I've taken from a book that is presented to patients when they're being educated in what's going on in their nervous system when they're experiencing chronic pain. And we know that many people who experience chronic pain would avoid certain actions in fear of getting even more injured. But we also know that with chronic pain, people actually have to move in order to alleviate their pain, because most of it, let's say with rheumatoid pain, what happens is our joints hurt because of arthritis. But in order for us to somehow diminish the experience of pain, we need to actually have stronger muscles. So in order to have stronger muscles, we need to push through that initial pain. And we need to stop worrying that we're going to injure our joints even more if we exercise. It's a very counterintuitive notion for the folk belief of what we're experiencing when we're experiencing pain, and what it means to be in pain, and what pain signals. So this here could be considered as a folk biological notion of pain, when we identify pain as some sort of an indication of tissue damage. So if we always consider pain to be associated with such, then we wouldn't be able to explain chronic pain that doesn't have a unidentifiable current tissue damage at the very least. And we wouldn't be able to also explain intractable pain, which could be detected with functional neuroimaging, and we can claim it's real. So this is why the revision in the International Association for the Study of Pain happened, because that's a sensation that we could have in the absence of tissue damage, but it's a similar experience. I'm sorry, not the sensation, similar experience to the experience we have when we do actually have some tissue damage. So there's this very counterintuitive, very opposite to our folk belief of what pain is and what it means, that needs to be changed here through education. So we're going to make an intervention on the cognitive element of the experience of pain. It's not going to be the emotional, it's not going to be the sensory, but it's the cognitive element. So here's how that state of the nervous system is explained. Obviously, there's a metaphor here, but the metaphor refers to what's happening in your body. So what people are told to think about is this alarm system that used to work well. That is, when you did injure yourself, this alarm system would alarm you by the experience of pain that there is a tissue damage. But then once the tissue heals, in some cases, that alarm system just keeps going. So you have that same experience of pain, even though there's no tissue damage, right? And here the explanation is that's what's happening in your nervous system. So it keeps firing even though there's no actual tissue damage. So then I'll go back to the way the physicians that apply that method talk about it. So what they're aiming to do is, and these are my highlights, what they're aiming to do, they say, is to change somebody's understanding of what pain actually is. Then they explicitly talk about changing a theoretical framework. And then they're talking about a shift in the conceptualization of pain. So I take all of these goals to be what the prediction or the prescription of eliminativism gives us. It tells us we'll have a new theory. That theory will have to replace what we thought pain was. And we have to reconceptualize pain in our daily context. So we've changed what we thought pain was in science, but also we need to do that in our everyday lives so we can treat our pain. Then another terms that are used in this context are explicitly replacement, de-education. I particularly like this one because it tells us that we've learned something and now we have to unlearn it so we can replace it with something that is more accurate. So these are prior misbeliefs, and we need to make sure that in whatever way you came to have them, in whatever way you were educated in these beliefs, we have to reverse it and educate you in these new beliefs. And in particular, the main belief that is aimed to be replaced here is that pain is a signal of tissue damage. So once people are de-educated from that kind of belief, we have this replacement of one notion of what pain is with another. That's my claim. So this I take to be an instance of eliminativism because we're replacing one concept with another, radically different. We're replacing one theory with another, radically different. But nowhere in this situation do we abandon the notion of pain. We're only abandoning the notion of what pain is. All right, we went over this one. So here are the conclusions that I want to draw on this basis, is that epistemic pain eliminativism has actually occurred in science. We do have these theories that are radically different, and they have replaced the old ones. So this is both epistemic and predictive. Then we have epistemic pain eliminativism has occurred in a non-scientific context, in this context of pain neuroscience education for chronic pain. So we don't need to make that distinction that Coninx makes between the two contexts. But also I want to take it one step further and say that pain eliminativism is well advised in everyday context as well. Now, this is a guess. Obviously, I don't have an example at this point, but I want to argue by analogy that the way eliminativism worked out well in the case of pain neuroscience education, there are good chances that that kind of eliminativism may be helpful in other contexts, in other everyday contexts. So there will be situations in which we will say, yes, it's better to change the folk beliefs about pain in this context, even if we're still using that notion of pain that Coninx, for example, will want to change. And finally, as far as ontological eliminativism is concerned, I want to claim that pain is real, but is that different kind of real way. It's surreal because I want to focus on the experience of pain. It's the dreaminess of pain. It is the personal experience of pain. That's why I'm focusing it on surrealism rather than realism proper. And then what counts as eliminativism in this case will be the elimination of the constructs that we've been postulating to explain pain rather than pain itself. So that is what I have for you. Thank you.
We're going to take a 5-minute break and then we'll have